Hello, I'm Jean Campbell, and welcome to I'm Fine.
Disclaimer. This episode features sensitive content and is strictly opinion-based, exploring an individual's personal experience. Please take full discretion when listening and enjoy the episode.
It's such a pleasure to have you here.
Thank you so much for asking me to be here today. I'm so excited to be here with you and talk about this. So
Yeah. No, I'm super happy. So you personally developed pain and addiction recovery programs for some of the best known health and addiction treatment centers in the US.
Yeah.
Amazing. Thank you so much for coming.
Yeah. That bio is a little bit outdated because when you said 25, I was like, well, I don't want to date myself, but it's actually 30 now.
No way.
Yeah.
Oh my God.
I cannot believe I'm saying I've been doing this for 30 years.
Wow.
Yeah.
So I'm speaking to a veteran. What an honor. So I think it would be really great to kind of start off by maybe talking about your introduction to pain in your own life. Obviously, pain is something that everyone experiences in some capacity, somewhere along the line. And it would be amazing to hear that.
I would love to tell you about it. It's a personal story for me. It's a passion for me. It's been my life for way longer than 30 years, right? I was educated 30 years ago, or finished my education 30 years ago, but it started well before that. And so I'll go all the way back to my introduction to pain, okay?
Amazing.
So it was actually on Easter Sunday, which was interesting. And so I'm the youngest of 4 children, and I'm the boy. And then I had twin sisters in the middle, and then an oldest sister. And so we were at my grandparents' home on Easter Sunday, and my grandfather was a physician, a surgeon. And one of the twins on Sunday morning woke up, and we called my grandfather Dr. Bill, right? Instead of granddad or what have you, we called him Dr. Bill because that's what everybody else called him.
Yeah.
And so Easter morning, my sister, one of the twins, said, Dr. Bill, I have a real pain in the side of my abdomen. And he said, you'll be fine. Don't, like a good grandfather, you'll be fine. Don't worry about it. And as the morning progressed, we had breakfast with my grandparents and my parents, and we were doing the typical Easter.
The ritual.
The ritual. Yeah. And the day continued, and my sister would say, Dr. Bill, I'm really having a horrible pain. And he would just kind of pass it off all day long. And so we had lunch, Easter, the whole ritual thing, right?
Yeah.
And then about 4:30 in the afternoon, we were in their den, and my sister was sitting there, and she said, my pain is getting worse. And he said, Becky, how long have you had this pain? And she said, it just started, but it's new, and I've never felt it, but it's very sharp. And and he kind of giggled, and he said, I'm sure you have gas, but lay down on the sofa and let me come over and just palpate it and feel it. And so she laid down on the sofa, and it was my grandfather, my sister, and I was in the room, and I was probably, 19, 18, 19. And so, and my grandfather expected me to be a physician, right, my whole life. And he's like, you're going to be a doctor. And he's like, let me show you how I'm going to do this. And so he walked over and he palpated my sister's abdomen.
Yeah.
And I'll never forget, he looked over at me, and he looked back at my sister, and he felt her abdomen again. And he said, okay, well, get up and we're going to go to the hospital.
No way.
And my sister said, what? And he's like, let's run up to the hospital and do some imaging, right? And I was like, well, what's wrong, Dr. Bill? And he's like, let's just go to the hospital. So the 3 of us, we tell my family we're going to go up to the hospital, and they're like, okay. So we get up and we go to the hospital, and it's like 5 o'clock in the afternoon on Easter Sunday. And he puts her in this machine, and he does this imaging of her abdomen. And he said, we're going to go to Houston, Texas. There's a hospital there called MD Anderson Cancer Hospital. And my sister's like, what? And he said, you have a tumor that's the size of a grapefruit.
No way.
Yeah. And it took my breath away.
That's shocking.
Yeah. It took my sister's breath away. My grandfather, I could just see it in his face that he was upset because all day long he had said nothing, it's nothing, right? And my sister said, Dr. Bill, it's okay. okay, don't be upset, but yes, let's go to Houston. So long story short, we go to Houston the very next day on Monday, and she's admitted to this hospital, cancer hospital, and they do more diagnostic workup on her. And she had indeed a very rare tumor on her spleen. And so they said, we're going to have to remove the tumor, do chemotherapy, and then radiation. And so they removed the tumor, did chemotherapy and radiation. And, she went through kind of a rough time. She was experiencing ongoing pain from that, but it was related to, surgery and what have you. So they removed it. 6 months go by, about 6 to 7 months go by, and the tumor grows back in a different place. And
how old is she?
She was 25 when so she was still 25 at this time. And so she was 24 when they found the tumor, and then she turned 25 during the treatment. And so they found the second tumor as it grew back 6 months later, and they removed it, did chemotherapy. 6 months go by, about 6 to 7 months, it grows back in another place. And this went on for 3 years.
Wow.
And so they would remove a tumor, chemotherapy, surgery, what have you. And then she developed something called chemotherapy neuropathy, right? So neuropathy is a nerve, our nervous system, when, it went all the way down to her feet, and the effect of chemotherapy can be so strong that it damages the nerves and causes permanent nerve pain. And so she had this nerve pain that would go all the way down her legs. And so not only was she had a daughter in the first grade.
Wow.
And she was divorced, and so she was a single mother with a daughter going through cancer treatment. And she had the support of our family, but basically felt alone and isolated, depressed, developed anxiety, developed pretty severe depression because the tumor kept growing back, and she was worried about her daughter. And so this continued for 5 years.
Wow.
And
5 years after the 3
yes.
years.
Yeah.
Really?
No, I'm sorry, 5 years total.
Okay.
Yeah, 5 years total. So 2 more years, and the tumor just kept continuing to come back. And so, oddly enough, another holiday on New Year's Eve of 1989, she wanted to go to the movie, and it was, New Year's Eve. She didn't feel good, but she's like, take me to a movie. And so I took her to see a movie. I'll tell you the name of the movie. You may not remember this movie, but have you ever heard of Beaches?
I have.
With Bette Midler?
Yeah, I haven't seen it,
Yeah,
though.
it's an amazing movie. Probably not the best movie to take someone that's very ill to, right?
Yeah.
Because it was about illness and cancer, and
my God.
I didn't even know. And neither did she. So we're sitting in this movie, and she's just bawling, and I'm bawling watching this movie. And we go home. She walks to the car. She walks to the house when we get home. We went to sleep. And the next morning, on New Year's Day, my mother is up cooking breakfast on New Year's Day, and her twin sister is in the kitchen, and I come out of my bedroom, and my mom said, why don't you go get Becky and wake her up, and we'll all have breakfast. And so I went into my sister's bedroom, and she was laying in bed, and I said, Becky, come here, let's eat breakfast. And she had these tears just coming down her eye, and I said, what's wrong? And she's like, I can't move. And I said, what do you mean you can't move? And she said, I can't move my legs. And I was like,
goodness.
yeah, you can. You're just tired. Let me help you. And so I like lifted her up and kind of put her legs on the floor. And she's like, no, you don't understand. They won't move. And she, overnight, she had a tumor on her spine. It encapsulated her spine and paralyzed her from the waist down.
Oh my goodness.
And so that really advanced her cancer because they couldn't operate at that point. And they said, there's nothing we can do. It's going to grow, and you're paralyzed, and you'll probably never walk again.
God, what a horrific experience.
Horrible. And she really had significant physical pain for 5 years while she was going through treatment. She was on morphine because they said, well, she needs this extra strength morphine to help her tolerate the physical pain that she's going through. And then they gave her medication to sleep and medication for anxiety. And she just went through this horrible experience, and she died 6 months later, June.
I'm so sorry.
Thank you. And she died 6 months later, and it was just a traumatic experience for her daughter, for my mother, for her twin, for me, for my entire family.
Yeah.
And so when she died, I was a business major in college. Like, I wanted to be a banker, wanted to do real estate, wanted to, work in business. And I had no clue that I wanted to do anything else. And at my sister's funeral, the doctor that treated her pain was at the funeral. And he came up to me at my sister's funeral. It's very rare for a doctor to go to a patient's funeral. They typically don't go to funerals, right? So came to the funeral and he said, next week, why don't you come to my office? And I'd like to visit with you. And I was why do you want me to come to your office? And he said, just come visit. So I went to his office a week later and he sat down with me and said, what are you going to do with your life? And I'm sorry about your sister, but what are you going to do? And I said, I'm probably going to go get my MBA and work in a banking system or commercial real estate. And he said, you could do that. And I said, okay. And he said, I watched you for 5 years with your sister. You brought her to her appointments. You would come home from college, from your business school, and work with her. You'd bring her to my office, and you have great empathy and a great understanding for what your sister was doing. And I think you have a gift. And I said, what's that gift? And he said, I really think that you should be he actually used the word healer. He said, I think you have this capacity to be an empath and be a healer and help people. And so I was like, let me think about it. Long story short, I changed my entire trajectory.
Wow.
I graduated from undergraduate school with a degree in business and finance. But after visiting with him, I changed my life and I went back to school and did a degree in psychology and then went all the way through my doctorates, right? And really became, my entire life has been based on properly diagnosing and then treating people with complex chronic pain or other chronic diseases. And then what we would call, professionally, you would call it comorbid emotional problems like depression, anxiety, sleeplessness, trauma, post-traumatic stress disorder from having chronic pain, and really helping people from a multidisciplinary standpoint really learn how to manage and live their life as fully as possible with this chronic pain that they have. And so that's been my life now for 30 plus years.
What a remarkable thing to have spent so much of your life dedicated to.
Thank you.
And thank you for sharing your
That was a long story.
No, well, it's heartbreaking and such a lot to go through. And it's incredible that you've used your experience to dedicate your purpose to helping people who are going through a similar process, although there's different labels.
Right, yeah.
So when you say just a few things, so you said complex chronic pain and comorbid issues. Do you mind defining
I would love
what
to.
that means?
Thank you for asking. So a lot of people, as you said when we first started, you said pretty much everybody goes through a time in their life where they have pain. A lot of people have chronic pain throughout their lives. So the statistic in chronic pain is about, I think it's astounding, but about 33% of the population experience chronic pain. So that,
of the global population.
Wow. So that means that 30.
That's a staggering amount of people.
Huge. But it is peer-reviewed, published medical knowledge that there is a huge number of population that suffers from that chronic pain. So I'll give you an example. So I've run 28 marathons.
Oh my God.
I've done a couple of 100-mile races, a couple of 45-mile races, one 75-mile race. And so, my age, I'm 58 years old. So my right knee hurts, right? I have chronic pain in my right knee. And I get up every day and I function and I go to work and I am productive and I take care of my knee. And we'll talk about that later, about how to take care of some of our pain issues. But I take care of myself and I tolerate it. So that's chronic pain. And then complex chronic pain, or another word for it would be chronic pain syndrome, is when someone develops truly a failure to thrive. So what that means is with complex chronic pain and a failure to thrive chronic pain, chronic pain syndrome, it really means that someone has some sort of physical pain caused from something. It can be a migraine. It can be from a back surgery. It can be from lack of a back surgery. It can be really from a car accident. It can be physical or
also mental.
It can, but the piece that I'm talking about is a physical pain. And then because of that physical pain, someone develops emotional responses like sadness, depression, Anxiety. Fear is huge of saying,
massive.
Oh my gosh, I'm never going to be able to, I'm not going to be a dancer anymore. I'm not going to be an athlete anymore. I'm not going to be able to lift my children or my grandchildren.
Or even like, I mean, I would say that in my experience, I definitely had moments where it's not even like I had something where I couldn't have chronic pain. I was just like, well, I'm 18. Like, what about the rest of my life?
Exactly. It's huge.
Yeah.
And so that's where you develop, that's my specialty, is working with that complex piece of it. Because like me, a lot of people have back pain, a lot of people have knee pain, a lot of people have little aches and pains that are chronic, but continue to live their life, right? Like, it's okay.
It doesn't take over.
Yeah, it doesn't take over. So complex or chronic pain syndrome is when it really envelops and takes over your life, and you're not really able to live life fully, right? So you become somewhat isolated. You have problems sleeping. You develop problems with relationships with family, because they look at you and go, I'm not...
Lighten up.
They're like, lighten up. And they look at you and go, you're a beautiful young lady.
Yeah, like, it's fine.
You look great. It's going to be fine. Don't worry about it. And you're like...
Yeah, you're just thinking like, well, why didn't you try out being me?
Why don't you feel what I feel?
Yeah. Would you say that the difference between chronic pain and chronic pain syndrome and it becoming the syndrome where the lights really go out, is that, does that correlate to how extreme the pain is? Does it correlate to the trauma around it? Or what is it that tips it into
question.
that?
Those are such good questions. So let's talk about the piece of the first one you said, does it correlate with the intensity, right? So the intensity really doesn't technically have anything to do with it. So let me give you an example. So we all live everywhere in the world. You know, there's this, I call it a stupid scale, this stupid little scale of 0 to 10, right? You go to the doctor and the doctor says, here's a scale of 0 to 10, 0 being no pain, 10 being I have to go to the emergency room. Where do you fall, right?
It is a stupid scale.
It's a stupid
I agree.
Scale. And it's like, oh, today I'm a 7. I feel horrible. Or it's a 9. Or a lot of people say it's a 13. And they're like, no, it ends at 10. And you're like, no, it's worse than a 10. And so, you know, in 2024, that's the only way we really measure pain, is this silly scale when doctors, brilliant physicians and nurses and healthcare providers go, what's your pain level? Oh, it's a 7. All of us think of a 7 differently. My level 7 pain is probably very different than your level 7 pain. You know, and a quick way to talk about that would be women in labor, women having children, right? Some women use an epidural and some women give birth naturally. And the feeling of that sensation of pain for every woman is completely different. So the same thing is in our physiology for back pain, shoulder pain, headache pain, whatever the pain is, we feel it differently. So for me, in my 30 plus years of experience in measuring pain with someone, it's more about, believe it or not, it's about the amount of emotions that are involved and the amount of coping skills that someone has, right? So if you're having tremendous fear, anxiety, depression, not sleeping, not eating correctly, you know, eating fried food, smoking nicotine, drinking a lot of caffeine, the only way that we feel physical pain in our body is because we have a nervous system. That's the only way pain is generated, nerves. And the nerves go from the tips of your toes and the fingers all the way into the spinal cord and up the spinal cord to the brain. And so all pain signals travel through the nervous system. So when the nervous system is activated by anxiety or depression or caffeine or nicotine or fried foods, the nervous system begins to vibrate, right? And the more pain that you feel, or the more it vibrates, the higher level of pain you're going to physically feel. So when our nervous system is calm, we actually feel less pain. And so emotions actually control the nervous system.
Yeah, they have a huge part to play.
Huge part to play.
Because also, if you're someone who's experienced a great deal of suffering or trauma, maybe in your childhood, and that's not something that you've ever had access to, let's just say, then you're already surviving.
Exactly.
So then you get put in a situation where you're in like unspeakable physical pain and it's not possible.
That's exactly right. Yeah. I call that, part of that is post-traumatic stress disorder, right? You've got this trauma from whatever that trauma may be, and it carries carries forward, and then you add in a physical injury or physical pain, and it builds on top of the trauma, and then the trauma builds on the pain, and it just goes into this awful cycle of chronic pain. We get caught up in this cycle of pain, right? And when we're in this cycle of pain, you think of it as a whirlpool, right? Of going down, and you have to crawl out of that whirlpool, and it's very hard. And so when you don't, even the smartest people, I work with executives, I work with physicians, with attorneys, with trauma surgeons who have had chronic pain that don't know how to get out of it, right?
Yeah, so it's not like an aptitude test, because I think something that's probably, actually is difficult for people living with chronic pain or potentially slip into that psychosomatic chronic pain syndrome is the feeling that you should be able to do it better.
Yeah, exactly. Yeah. Let me give you a quick example.
I'm totally here for the example.
Okay, good. Yeah. I worked with a trauma surgeon, a pediatric trauma surgeon. It was a female. And she was probably, when I saw her the first time, 37, 38 years old. She was the number one expert in the United States for, the number one expert witness in the United States for severe child abuse.
Wow.
And so she would work with infants and young children who had been raped, who had someone had inserted something into the child's body that had to be surgically repaired. And so she did this for 6 years. And she would not only see it, she would repair it, and then she would have to go testify on the witness stand as to what happened to this child, right?
Horrific.
And what she had to go through. Horrific trauma for the child, but almost equally horrific for her, right? Having to repair this damage of these infants.
Well, you're not doing that job without caring about people,
That's exactly right. Yeah, right. So she did this for so many years, and then one day she was like in a car accident. It was a fairly minor accident, but she developed whiplash, where someone hit her from behind and her head went forward and then went back, and she had some disc problems in her neck. Well, hers was not abnormally physiologically horrible on x-ray or MRI. The doctors looked at it and said, well, you've got a little bit of whiplash, put some ice on it and it's going to heal. I believe because of her trauma that she already had, she developed this pain, and it intensified 100 times, right? And she became addicted to opiates and medication and sleeping pills and
That's her coping mechanism.
And it went on and on and on, and she had to stop practicing medicine. And she said, I'm not going to practice medicine anymore because I physically can't do it. I can't use my neck. I can't bend it. I can't do this, right? And so her husband and her family brought her to treatment with me. And when I started talking to her about pain and trauma, she literally looked at me and she said, you're a freaking idiot.
Really?
Yeah. And I said, excuse me? And she said,
yeah, I bet you did.
She's like, excuse me? She said, I'm a trauma surgeon.
Do you know who you're talking to?
Do you have any idea who you're talking to? And you're telling me that my trauma is affecting my pain? And I said, it absolutely is. And so for the first 2 weeks, completely resistant to any information I would help her with and talk to her about. And then one day I just said, look, your family really wants you to do this. Your children are asking you to do this. Just surrender and let's work together. Just surrender and give me 2 more weeks. And if nothing changes, I'm going to tell your family there's nothing I can do for you and you can go home. But just stay for 2 weeks with me in my program. And
it's so interesting that, because I think it's very easy to almost be to fall into the despair of hopelessness, of like, you know what, piss off, like you actually can't do anything, like, because the idea of going to another person and it not working out is probably so terrifying that the defenses are like
absolutely so high. Yeah. So she decided, fine, I'm going to do everything you tell me to do for 10 days, and after 10 days I'm leaving. So we worked together for 10 days and she did everything I asked her to do. And on the 10th day I said, well, it was nice meeting you. And she goes, what do you mean? And I said, it was nice meeting you. You're leaving today, right? And she's like, I feel better than I've ever felt in my life.
No way.
And I'm like, wonderful. Will you stay? So she stayed with me another 6 weeks and did some work in a multidisciplinary fashion, meaning we did some physical therapy, we did some aquatic therapy, we did some nutrition. We did a lot of things together, coping skills, psychology, lots of things together. And she finished my program in about 10 or 12 weeks, went home, and today it's been in 6 or 7 years. She is back at surgery. She does not work with trauma. In other words, she doesn't work with child abuse cases. She still works with children, but not in child abuse. So she somewhat changed careers and did a lot of therapy through her trauma and a lot of therapy through her chronic pain. She still feels some pain, but she thinks of it very, very differently. And she's able to live her life fully and function and is this amazing woman.
So in her case, so when it comes to old-fashioned chronic pain, are the causes that you see mostly physical? To what degree are they mental? And to what degree is there kind of matrimony between the two? Because obviously the case that you've just described, they're quite interlinked.
Yeah, absolutely. So in my years of working with chronic pain patients, when you ask, is it physical or is it emotional? I would say that about 70% of the patients that I personally have treated were organically started from some sort of physical injury, right? And so, in other words, when you do an MRI or you do an X-ray or a physical exam, we can pinpoint what it is physically and hopefully work on that. But sometimes, even when it is physical, after about 90 days to 6 months, it's beyond what we call normal tissue healing. And sometimes it never feels better. Sometimes you have to learn how to live with the physical pain and then work on the emotional components of it. And then probably 30% of the patients that I've seen over the years that I've worked with them, maybe 35%, there is nothing we can find physically at all. No, so we would say it's non-organic, right? It's nothing that we can find on imaging, MRI, X-ray, physical examination.
No medical explanation.
No medical explanation. It's just sometimes what we call myofascial pain or total body pain, right? With nothing that you can find. So then when we begin looking at it from an emotional standpoint, we often find some sort of early trauma. And I'll tell you that in women with total body pain, a fairly large number of women who experience chronic pain with no organic syndrome, meaning no medical explanation.
No physical attributes.
Right, yeah. A fairly significant number on interview, the first interview, I always ask, I build a relationship with the client. So in this case, with the woman that I'm working with, building a therapeutic relationship, I always ask, do you have a sexual trauma history? Over 90% of the time, the first answer is no. First time is no. However, as you're working with that person and as I'm working with these people and women and develop a really close therapeutic alliance, they're learning about their pain. Oftentimes, 3 weeks into treatment, a woman will either start crying or say, I need to tell you something. And what is it? And they'll say, I was raped, or my boyfriend sexually molested me, or I was molested by somebody, or there was a sexual trauma history. And so I'm not saying it's a huge number, but it's a fairly significant number of women who have total body pain with no physical symptoms do have some sort of physical sexual trauma.
Wow.
Yeah.
That is really, really revealing, but somehow and unfortunately not that surprising. Because I think, the experience of being a woman and growing up and everything, you are at risk, and that's obviously very sad. But I suppose a positive that comes out of that, out of what you've said, is it right to say that in kind of addressing that sexual trauma that you would then be on your way to healing?
Yeah. It is an amazing process. I kind of see it as a kind of a caterpillar turning into a butterfly, right? Someone that has really compartmentalized their sexual trauma and don't even really think about it themselves, but it manifests in the form of pain, anger, resentment, frustration, self-loathing. Yes, lots of self-loathing. And then going through the treatment and then revealing the sexual history and then working on that trauma. It is an amazing process. And these women can really come out of that in so much of a better, healthy spot in their life.
Yeah. What beautiful work to be doing.
I love it.
And so what would you say are the kind of key components to entering a more manageable relationship with chronic pain, or possibly even healing from it entirely?
Yeah. So, and believe it or not, some people out there that may be listening to this, a lot of people even sit in front of me and say, I'll never be pain-free. There's no way. And sometimes, quite frankly, I'll say to a person, you may never be pain-free, but you're going to think about your pain differently. So it's going to feel better. And they kind of look at me and go, I don't know about that. But there are quite a large number of people who do become their pain level becomes so minimal that they don't even recognize it anymore. And so some of those components, I believe, the first and biggest component is actually doing something to get help, right? So saying to either their healthcare provider, their medical doctor, their family, I understand that I need to get help for this pain, and maybe medicine is not the only answer. Right?
Yeah.
So maybe opiates aren't the only answer. Maybe sleeping pills are not the only answer, or anxiety medication, and going from physician to physician to physician has not worked for me. So let me go get some more help. And so sitting with a mental health care provider, a psychologist, a psychiatrist, a therapist, social worker who truly understands physical pain, right? Or even pain in general, but body pain, and knows how to work with someone is the first step of saying, I need help, right? And then opening up and talking about the effects of your physical pain, right? How has this physical pain affected your mind? How has this physical pain made your body worse, right? And really discussing that with a pain expert, and then working on techniques and tools for overcoming pain. So some of those and a lot of times patients go, really? Is that going to help me? But the very first thing is learning how to breathe properly, right? And breathing diaphragmatically from your diaphragm, like an opera singer.
Into your stomach.
Into your stomach, right?
In layman's terms.
Yeah, thank you. Yeah, breathing way down in your belly. So a quick example, when you're asleep at night, and you're sleep, even if you have a partner, I want you to look at your partner at night when they fall asleep. And you're going to notice when someone falls asleep, they stop breathing from their chest and they start breathing from their belly. So they'll breathe down here in their belly instead of their chest. During the day, when you wake up in the morning and you start talking, or you say good morning, or you go get coffee or what have you, we start breathing from our chest. And see the difference?
Yeah.
You breathe up here. And what that does when we breathe in oxygen and it stays in our lungs, it just circulates and goes back out. When we learn how to breathe from deep down in our belly and take deep breaths from here, it pushes the blood all the way to our feet and all the way to our head.
Wow.
And it recycles the blood continuously with new oxygen. So it gives our body oxygen to allow it to heal quicker. Yeah. And even when we're not sick, right? Even, being well, when you breathe down here, we feel more energy. We feel less depressed when we breathe with our diaphragm, because it's fresh blood, fresh oxygenated. Thank you. Blood that really recycles all the way through our body. And so believe it or not, when you have oxygen, can you say that again?
Oxygenated.
Thank you. I don't know what's my problem today. But when we feel that, what it does is it decreases the inflammation in our body. So another technique, speaking of inflammation, is all people with chronic pain, and a lot of people with just pain, have inflammation throughout their body, right? And when our body is inflamed, right, it impinges on the nerves and creates a tighter sensation on our nervous system. We don't cognitively feel it. We don't know it's doing it, but it really is doing it, and it causes your body to have increased physical pain. So when we eat things or drink a juice like turmeric and ginger, that's an anti-inflammatory juice. So when you drink it, you'll notice the inflammation in your body actually goes down, and you do feel better. When you eat things like cherries, and when you eat fresh vegetables, and you eat foods that are considered anti-inflammatory foods, it actually decreases your chronic pain. So another thing we do is yoga, and we do Tai Chi, we do aquatic therapy, because a lot of people with chronic pain, when you're on the ground, we have the gravity of our body on the ground, and a lot of times you can't exercise appropriately, so we'll get in the pool and exercise, and you float, right? And so when you float,
and you feel free.
You feel free, right?
Yeah.
And so you're able to move better in the water than you are sometimes on the ground. And so we'll do, I believe, that exercise and eating, and I call it the biopsychosocial, right? Being around people people instead of being isolated. Exercising, doing psychotherapy, and doing work around your pain really does help the entire system feel better and heal. And then there's so many other techniques that we use, like something called dialectical behavioral therapy, DBT. So just talking to a therapist about techniques for reducing pain, about your feelings, about your trauma, doing trauma resolution. I'm sure you've heard of EMDR.
Yes, I've done EMDR.
Yeah.
Quite hardcore.
Exactly. Yeah. So EMDR is something we use in chronic pain relief. It is really helping overcome previous trauma, or even the feeling of pain can be relieved doing eye movement desensitization, right? And techniques like that. So there's a lot of techniques that I would be happy to share with your audience, or you with your audience, but there's so many techniques that we can do in life that really do help reduce our physical pain.
Another thing that I would really love to talk about, as it's part of your area of expertise, is the correlation between chronic pain and addiction. And obviously you touched on it earlier with the case that you used as an example.
Huge part of my practice is chronic pain and addiction. And I think what I want to say to you, and really to all of your listeners, is that overwhelmingly the patient is not what we would call a classic addict, right? They're not an addict many times because they were born an addict or they have a gene for addiction, but they become addicted to their medication because a physician prescribed a certain type of medication. And back in the States, we have a huge problem, and I know it's worldwide really, but in the States we had a huge problem with the opiate crisis. And I believe that physicians go to school to learn how to heal people. They really want to have people, their patient, feel better, right? To not want to do that would be idiotic, right? Or cruel.
A bit like Psycho.
Yeah, Psycho.
Maybe.
Yeah, exactly. Maybe some of them can be, but I would say, physicians really want to heal people. And because pain is so personal, when a patient goes to a physician and they say, I'm in a level 9 pain, and the physician, they say, well, I'm going to have physical therapy done on you, come back in a month, and they come back and they say, I hurt worse. I couldn't do the physical therapy because my shoulder, my knee, my whatever it was, it hurt worse. So I stopped doing it. They're like, okay, well, let me refill your medication, right? And then a month later, they come back and they're still feeling bad. And they're like, let me send you to a specialist. And then they send them over to another, like an orthopedist or a neurologist. And the neurologist says, well, I see Dr. Smith prescribed this to you. I like to prescribe this different medication. So let me put you on this narcotic, right? And they do it because they think it's going to relieve the patient's pain. But in fact, in the United States, of course, the FDA, the medication that's FDA approved for pain, like OxyContin or oxycodone, is really meant for short-term pain or long-term cancer pain, not for someone that has chronic pain. So
because it's not a long-term solution.
It's not a long-term solution.
Because also it has collateral effects massively.
Massive collateral effects. And proven scientific medical fact, there's another syndrome when people are taking narcotics called hyperalgesia, right? Hyper being extended or high, algesia meaning analgesic. So using too much analgesic.
What is that?
After about 90 days, we all would develop hyperalgesia. And what that means is that we've had so much medication over 90 days that we actually become more sensitive to pain. It's a reverse effect. So it takes more medication to have the same effect. So our brains trick us.
That's so scary.
Yeah. Our brains trick us and say, well, you were taking 180 milligrams. Now you need 360 milligrams to have the same effect. And that's just, it's a fact. You develop this hyperalgesia after about 90 to 120 days. You go back to your doctor, you say it's not working, and he doubles the prescription. And it's so counterintuitive because of all of the collateral damage it does to your body, your kidney, your liver, your brain, your sleep time, your wake time, your relationship, right? You come home and you're just a zombie. You don't feel like doing anything. You don't want to go to the movie. You don't want to go eat out. And it really destroys families, and it destroys relationships with partners, boyfriends, girlfriends, husbands, wives, children. And so it really is, I believe, an awful thing that physicians have had a good intention of doing, but it just didn't work. It backfired. And so what we want to do is, with patients that are using opiates over a long period of time, we want to hit the reset button because we want to know what their their true baseline pain is and how they're managing it. So the only way to do that is to go through a medically supervised detoxification program. So in other words, let's taper the medication to 0. Let's use an alternative medication to help you maintain some the symptoms of a detox, to keep you calm and cool and collected. Let you detox from it and have 0 medication. And
so then you can treat the source.
Yeah. And then it is absolutely amazing. Someone that's using any pain medication, that's been using it over 90 days, 120 days, a year, 2 years, 3 years, whatever it is, about on day 4 to 5 of detox, you're lowering the medication, building a relationship with the client or the patient, and the patient looks at you and says, I don't know why, but I actually feel better.
My gosh,
my pain is actually less. So when you detox off it completely, over 90% of the time, the pain level drops by 50%.
Wow.
From doing away from the opiate.
Isn't that so crazy?
It's amazing. It's crazy.
I hope that inspires a lot of people.
I do too.
It has been so incredible to speak to you, and I feel personally so grateful. And I'm sure that a lot of people will benefit from hearing your wisdom and experience and your personal experience as well. So if you were to give some advice to someone who may be struggling with their pain or they're at the beginning of their journey and they're feeling that sense of hopelessness, what would that be?
Yeah. So first of all, thank you. I hope my passion came through.
It did. It really did.
I hope you could tell, and I hope your audience understands that this is my passion, to see people, this sounds really odd, but see people go from a really desperate point to really living life, thriving and having an amazing life. And so I want to say...
And it's clear that that's possible.
It is. So I think my wisdom is twofold. One thing I want to say is I do not care where you come from. When you have physical pain and you feel like it's debilitating and you can't do anything, you feel like you can't do anything, what I want to say is this brain in our head is the most powerful thing on the face of this earth. And we can utilize our brain to change the way we physically feel. You may need a little help from someone, and you may need a little bit of help from a therapist or a friend or what have you. But if you can visualize yourself in a different spot in life, what I want everyone to do when they're listening to this is I want them to close their eyes, if they have physical pain and chronic pain, is close their eyes and see what they want themselves to be doing. On a boat, going to a movie, climbing a mountain, going snow skiing, running down the street, whatever they want to do, I want them to close their eyes just for 30 seconds and see themselves doing that. And then hold on to that vision, and every single day, 3 times a day, pause for about 30 seconds or a minute and see that vision. And I promise you, if you can see it, you can achieve it.
Amazing.
So that's my wisdom. It's just true. And I am a living example of, if you feel it and you want it bad enough, you can absolutely make it happen.
Thank you so much.
Thank you so much for joining us today. If you enjoyed this episode, subscribe to the podcast and leave us a review wherever you listen to your podcasts. For updates on upcoming episodes and behind the scenes insights, follow me on Instagram at Jean_Campbell. You can also find out more information on our guest in today's show notes. New episodes of I'm Fine are available every Friday. See you next week.